Having a baby is life-changing. From the moment that test turns positive to the second you lock eyes on your new baby in the delivery room, it's a journey with one constant: change. Throughout pregnancy, your body is always changing and adapting. Physical changes happen. Your skin stretches. The numbers of the scale climb. But you also have to wrap your mind around your new role as parent. All of these changes continue into the recovery process. There are two main types of childbirth: vaginal and C-section. Recovery times can vary based on your delivery. Dr. Selena Zanotti is an OBGYN who helps guide new parents through not only childbirth, but the recovery too.
If a woman has a normal vaginal delivery without any tears, they recover pretty quickly. They're moving around that night. There's no problem driving. They can carry their baby and there's no real issues.
Typically, there aren't many restrictions, and you may only stay in the hospital for a day or two.
When a woman has a C-section, because there's an incision in their abdomen, there are a few more restrictions. The main one is no heavy lifting. Usually for about 6 weeks, the heaviest thing they should be carrying is their baby in a car seat.
A C-section often means more restrictions and longer healing times. You may also need to stay in the hospital for a few more days. When you get home, you'll continue to see your body change. One thing that can shock first-time parents is the blood.
It's a very bloody procedure, whether you have a vaginal delivery or a C-section. But after you deliver, that uterus, which was quite large, has to now shrink back down, to the size of an orange. And it does that slowly over time. But as it's doing that, you do have bleeding.
Some people describe this bleeding as being similar to a heavy period. Now, there are some things that you should keep an eye on during the recovery period. One of those is blood clots. It's okay to have occasional blood clots as you recover.
You might pass a little clot that might be a quarter size or even an egg size, but if you only pass one and it slows down, you're fine. What we're talking about is if you're passing those egg-sized clots repetitively, every hour, every couple hours, and it's not slowing down, or you're soaking through your pad in an hour and that's going on for a couple hours, we want to know about that.
Another is depression. Even though most people think of the time right after birth as a happy one, where you're filled with excitement and joy, there can also be other emotions swirling through your head. After birth, you go through a host of hormonal changes that can take you from smiling happily to crying for no reason. Many people call this the baby blues, something Dr. Zanotti says is very common. About 40% of women might experience this in the first few weeks after birth.
They feel more irritable, but most of the time they're feeling well. It's just occasionally they'll feel those things. And usually within the first week or two, those symptoms are getting better. And those are symptoms that, really don't cause any serious harm.
But there can be levels of anxiety and depression. And providers like Dr. Zanotti say they worry about something called postpartum depression, a major depression that happens in the postpartum period.
And the difference between the blues and postpartum depression is it's not getting better after a couple weeks. And it often can be very consuming. And a woman's unable to enjoy being with their baby or with their family because they are feeling depressed more often than not, or there's a lot of anxiety.
There are many reasons why a person might develop postpartum depression. Hormonal changes are happening constantly, causing chemical changes in your body. There can also be a sense of being alone and anxiety around taking care of the baby. You might be afraid that you're not doing it right or are failing. The big thing is to have a support structure, people and healthcare providers who are ready to listen to your worries and be there for you.
Understanding that a woman is not herself when she's exhausted after having a baby and you have all these hormonal changes, and to not get frustrated. A lot of times we'll see women who find that they're crying for no reason or they're getting irritable. And when they have a partner that doesn't understand that or a family member that doesn't, it can aggravate the situation and worsen it. A lot of times they just need a family member or their partner to give them a break from the baby or just give them some time alone and sometimes just to sleep.
Recovery takes time. Your body needs to go through a process of adapting to not being pregnant and adjusting to the new journey that is parenthood.
What I think it's important for women to know is your body has gone through so many changes, and every part of you does, and they're normal. And there are things that can get better with time, but it's okay to ask for help. And if you don't know what's going on, talk to your provider, reach out to your family members. There are a lot of resources and ways for us to help you physically and mentally heal, but it takes time, and to not be impatient.